Good evening. I will call the Select Committee on Jobs and Economy Committee to order. Committee Secretary, would you please call the roll?
Assembly members Anderson, Backus, Carter, Hathan, Hibbets, Howdigi, Kasama, Koenig, Mosca, O'Neill, Torres Fawcett, Watts, Yeager, Chair Monroe Moreno.
And I am here. Will you please mark other members present when they arrive? If they do not arrive, they are excused, absence excused. Thank you all for being here. I'm sorry that we're starting just a few minutes late. We have one bill on our agenda, and that will be Senate Bill 4 for a hearing. But before we go there, we have a special comment from Assembly Member Koenig.
Assemblyman Neal kind of stole my thunder, but I wanted to publicly congratulate the UNR Wolfpack today for their 55-10 win over San Jose State. It's been a little bit of a trying year, and for them to bring us a little bit joy today was appreciated.
Thank you so much. We love it when any of our Nevada teams win, especially after the streak we've had this year. So with that, we will open the hearing on Senate Bill 4, and we will invite the presenters to the table. Good evening.
Good evening, Madam Chair and committee members. Tiffany Greenmeyer, Director of the Governor's Finance Office. I'm here to present SB 4. And would you like me to read every section first and then step back and then let each one come back up for each section, or do you want me to stop on each section?
Which is easier for you?
To read the whole bill first and
Let's
then
do
step
that.
back.
Okay.
Okay. Senate Bill 4, Section 1 requests $31,490,000 in general fund appropriations to replenish the interim finance contingency account due to the allocation for the purchase of forestry's fire trucks approved at the October 16th IFC, and another allocation to the food insecurity program approved at the October 30th IFC. Section 2 was removed. Section 3 requests general fund appropriation of $594,000 in fiscal year 2026 and $1,188,000 in fiscal year 2027 to fund portable medical care stations at multiple correctional facilities. These are on-med pods at $33,000 times 6 months. In the fiscal year 26 is the $594,000. The fiscal year 27 on the on-med pods is $33,000 times 12 months. That gets you to the $1,188,000. Section 4 requests $25,000 in each year of the biennium in general fund appropriations to fund the travel of the Commission on Innovation and Excellence in Education. Section 5 requests $1,950,000 over the 2026-27 biennium in general fund appropriations to the Commission on Innovation and Excellence in Education. Section 6 requests $14,585,755 in the general fund appropriation to fund the jail-based competency program, Division Public and Behavioral Health, and will allocate to Clark County in the amount of $8.1 million, and Washoe County in the amount of $7,515,000. $919 for the purpose of the jail-based competency. There is a conceptual amendment that adds section 6.5 for funding for the IFC contingency account to support Clark County jail-based competency program through DPPH. This adds $5,406,013 to include in the Clark County, to give more to Clark County, but we're going to put that into IFC contingency, and then when they come up with their plan, they'll request it. Moving on to section 7, request $7,630,000 in general fund appropriation to the University of Nevada, Reno, to fund the furniture and the equipment at the new Nevada State Public Health Laboratory located on the UNR campus. Section 8 requests $3 million in general fund appropriation over the 2026-27 biennium to fund stipends for the state public defenders and other costs of the department related to the compliance with the Davis consent judgment. Section 9 requests general fund appropriations in the amount of $1,256,686 in FY 2026 and $19,422,534 in fiscal year 2027 to fund the increased SNAP administration costs sharing implemented by the Budget Reconciliation Act and analytical technology software to review SNAP caseload each month to help with the error rate. Section 10 requests $1,250,000 in general fund appropriation to each year of the biennium to fund broker compensation for the purpose of compensating brokers to enroll individuals in plans authorized under NRS 695K. Moving on to section 11, requests $2 million in general fund appropriations over the 2026-27 biennium to fund community navigators for the purpose of providing education and enrollment assistance with battle-born state plans and Nevada Medicaid. And moving on to section 12, requests $330,550 in general fund appropriation to fund personnel costs and associated costs in fiscal year 2027, which was omitted in the 2026-27 biennium budget due to a separate legislation in the 2025 session that was not approved and created the position to be unfunded in the second year of the biennium. Section 13 requests $68.5 million in state general fund appropriations for the construction of the life science building at the University of Nevada, Reno. Section 13.5 requests for $68.5 million in state general fund appropriations for the construction of the new building for the Lee Business School at the University of Nevada, Las Vegas. Moving on to section 14, requests a revised maximum annual salary of $180,534 for the Director, State Chief Information Officer of the Governor's Technology Office within the Office of the Governor. This will allow the Director's salary to be higher than the Deputy salary in the same division. And last, the section 15 adds 2 members to the Commission on Innovation and Excellence in Education. And that concludes my presentation, and I do have, there's a lot of friends in this audience for everyone.
Well, thank you so much for the overview. I think it would be good if we go back to the very beginning, and the different sections are affecting different areas within the state, different commissions or divisions or departments. So let's just go through each section and have a representative from those sections come up to the table to further explain. And we'll start with section 4. I think we all know about Section 1 and the contingency account because most of us were here when we had to wipe that account out just a few weeks ago. So replenishing that is definitely needed. But no, before we go to Section 4, let's go to Section 3, the Department of Corrections. Let's go there. About the hybrid healthcare kiosks and just get a little more explanation about that. Hello.
Good afternoon or good evening. This is Jim Zarenda, DZ, URENDA. I'm the director for the Nevada Department of Corrections. What these systems are, like the easiest way to explain it, they're on-med stations that we do telehealth in. And what it is really doing, a majority of the visits will be done by primary care practitioners that will not be on location. It will be done by telemedicine. And certain specialists that we're able to do and set up appointments with. Most of the facilities that we are targeting, like one of these is Lovelock, where we don't have the medical practitioners that are available. Majority of those offenders that have certain treatments or need to go to care have to be transported out into the communities for their appointments, doctor appointments, and their care, which drives up the cost of overtime, and it also drives up the cost of potential lawsuits because they don't have certain physicians that have follow-ups frequently enough. So it's really, we're looking at the pilot program to start at Lovelock Correctional Center, Northern Nevada Correctional Center here in Carson City, and also the High Desert State Prison in Indian Springs. And the reason why we selected those three, first of all, Lovelock was easy because we don't have any practitioners that we can that are actually full-time at the facility because it's very difficult to find them. Northern Nevada Correctional Center, we have practitioners, but we don't have enough that are on staff. So the majority of those that are going out for things that could be strep throat, issues with their heart, cardiac, we send them out to local locations for their appointments. And High Desert Correctional Center or State Prison, just because of the sheer numbers that come out of there, that we don't have enough practitioners to actually see those offenders. So again, those have to go out into the communities. When you send them out into the communities, there's two things that come to issues. We have not only the overtime costs with sending minimally two correction officers with every offender that goes out there, but also the security risk of sending high-risk offenders out into the community for doctor appointments. Anytime you send a high-risk offender out there into the community becomes a dangerous situation, or could be a dangerous situation into the community with these high risks. So it's really going to help us. We're going to track it. So we'll be able to provide something to show whether or not these are really cost savings to us. We will be able to look at those that have gone through these appointments to list those that would have went to the outside if not these were in existence, to be able to track how much it would have cost in overtime and security measures. The only thing it will not track is the amount of lawsuits that were prevented or could have been could have happened from not having follow-up doctor appointments. But inside these telemed machines or rooms, they have all these different devices to be able to do blood pressure, stethoscopes in them. And the offenders will be doing this themselves under the advice of those that are live on video. But they could do scopes of the throat, a whole different types of equipment, medical equipment in there that we would actually be sending those to the outside appointments. Be able to do diagnosis, be able to do orders for blood work and things that we really couldn't do on our own inside the facilities or don't have enough staff to do that. So I don't know if that helps with some of it, but if you have any questions, I could hopefully get in more detail.
Thank you so much for the explanation. I know we have a member and we may have a few members with questions, but we're going to start with Assembly Member Watts.
Thank you, Chair. Thank you, Director. I am encouraged to hear that you're going to be tracking some of the impacts that this has. As you know, I think many members of this body are frustrated with the overtime issues, including the fact that we approved 47 new positions for the department, that your vacancy rate has been going down, and yet overtime costs have continued to soar, that mail issues that were not brought up in the session that concluded just a few months ago were brought up as a reason why those overtime costs continue to soar. So the question that I have is, how often will we be getting information back from you based on the reporting about this and the impact that it's having on reducing the significant overtime costs for your department?
James Arenda for the record. I'm not sure if it identified when, but we're going to be tracking it every day. So if LCB says they need quarterly reports, we'll have quarterly reports. If they need them biannual, we get biannual. But we will have that data tracked every month, so it would, even monthly is not a big deal.
Thank you. I'll defer to my money committee chair on the details of that.
Members, any other questions? Assemblymember Bacchus.
Thank you so much, Madam Chair. And I know we're not in the interim finance committee and we're subject to the governor's proclamation, but I couldn't help but ask, looking at this, I know there were like struggles with overtime associated with letters and items coming in to the into the corrections buildings. And maybe it's in another Senate bill that I haven't seen come over to us, but like, was there any discussion about like including like copiers or something so that we could end some of the struggles that were creating reasons why in those that are incarcerated were seeking medical relief outside, because I'm assuming telehealth would not really take care of that, and also to hopefully decrease some of the outrage that was created by the substance that has been able to get in.
Sure. Thank you for the question. James Arenda for the record. So you're correct. It will not reduce the overtime costs when it comes to do with the mail overdoses that are coming in with K2 and Spice. However, with the issues with the K2 and Spice, we determined that we will go through and provide a study that we've been in the middle of. Starting in January of this year, we started with a study at the High Desert State Prison through opioid funds that were given to us through Health and Human Services, a mail scanner that identifies K2 and Spice that comes in on the mail. So we're going to stop the study right now to be able to provide the results of the study and other studies that have been done in the United States to show the need for the mail to be scanned into the tablets and how many deaths and overdoses it has caused. We are closely approaching, we just had actually 3 overdoses in K2 and Spice 2 days ago at the Ely State Prison. One of them resulted in a death. We are now getting close to about 200 overdoses of K2 and Spice in the mail, so this is a big deal that we got to get this immediately going. So we do have plans to be able to provide that as soon as possible with the results and an overview study that we are stopping because it's that much of an emergency to happen. But you're right, it will not reduce overdose overtime. Currently, we are at 92, which every time I keep speaking to the legislature, it keeps going up. We're at 92 officers on average every single day doing overtime just for hospital trips and hospital stays and doctor appointments. And that will continue to keep going up if we don't go after the mail situation. And the situation that we did get the staffing from LCB, and thank you to those in this panel, getting the additional staff to help with the overtime costs with medical. However, those positions were not given to us until October 1st of this that just passed. The academy is running right now with new correction officers that will backfill into the current overtime positions that are in the facilities themselves. And then the next academy class, which should be starting in the end of January, beginning of February, will be the next class that'll fill these positions. But our attrition rate is still about 20 a month, so those 40 positions will be pretty much vacant in 2 months of attrition of losing staff that are statewide. Hopefully that helps.
Assemblymember Anderson.
Thank you, Chair. Thank you for the information. So you mentioned a study, and I feel like we've had a few of those when it comes to staffing issues. So how much will the study stoppage either cost us or save us of the initial investment that your department has already done for this study? And also, will that be able to be utilized, if it's saving us, can it possibly be utilized for some of the overtime that continues to be plaguing us as a state?
So James Aranda for the record, thank you for that question. So the study, what we did is we had a technical machine that's able to detect K2 and spice coming in, but it's only one machine that did about 20% of the mail coming into high desert. So we know 20% of the mail, how much mail is being laced with K2 and spice that's undetectable by the human eye. However, if you did the whole state with these machines, you wouldn't have enough money. You need about 6 of them just at high desert and all over. What the study is going to allow me to do is to be able to present, to be able to scan a solution, to be able to scan the mail into tablets so we don't allow mail to come into the facilities except for legal mail and special mail that we will allow under special circumstances that are like pictures and drawings from the children and family members that will be scanned through the machine. We will not be saving money. We will be saving overdoses and deaths. So you'll see results of overtime coming down when you scan the mail in and the K2 and spice stops coming in. You won't have the numbers of overdoses. But what you got to remember, which I want to make sure it's out there, is we have so much of this reams of paper that's in these facilities now laced with K2 and spice that's undetectable by the eye. It'll take a long time for us to weed all that out because we can't go into cell by cell by cell and test every single letter that they have in every single cell. So what's ever in there is in there. What you see, it could increase violence immediately, because what happens is when you talk about supply and demand, if the K2 and spice is not coming in through the mail, whatever mail is in there, the cost that they're going to be purchasing those through the gangs is going to go up. Debt that the offenders have for paying for this is going to go up, and that's where you'll start seeing some violence until all of it is out of the facility.
I may ask a follow-up. Thank you for letting us know about this again. I know that you've talked about this also in IFC, but I thought you had also said that there was a stoppage of a study during your prior answer. So that's what I'm asking about, not about the scanning. The stoppage that you mentioned, and maybe I misunderstood. That's the study that I'm asking about.
James Aranda, for the record, that study is not costing the state anything. I'm doing it with my own staff. It's data that we're collecting on a machine that was given to us from Health and Human Services to detect the mail, and it's keeping the data tracked of how much is coming in, how much was found that was undetectable by the eye. I could tell you right now since January with that one machine on how much mail has actually come into that facility that was detected by that machine, which will show, if you multiply that by 6 times there, by the whole state, it's astronomical. But it won't save any money because we're not paying for anything. No cost.
Thank you, members. Any other questions for Director Zorinda? All right, I am not seeing any. Thank you so much. And we're going to move on. I believe Senator Dondero-Loop is here for section 4 and 5, but we also have questions on section 13.5. So if you'll come to the table, because I believe that you may be able to answer some questions in our legal. I know one of my members specifically asked for you to be here, and Mr. Asher is extremely busy with all of amendments and everything that are going on. So if we'll start with 13.5 and go to Assemblymember O'Neill with the questions, and we'll go back to 4 and 5. Okay? Assemblymember O'Neill?
Thank you, Chair. I just trying to figure out how to preface this. I've been asked, and as you know, Mr. Asher, in the Assembly side, we've had some discussions on procedural actions, if they're appropriate, constitutional, legal, et cetera, and can be done. And I've been asked about its 13.5, in the governor's proclamation, he designated an amount of money to go to UNR. They have an ongoing project to build a building. It's my understanding it's already been in design. They've got a contractor designated, et cetera. And now we also have something for UNLV. And I did not know, Senator, I would have come to you if I had known this, what the status is of that. But I'm also curious, the legal part that I've been asked, since it's not in the governor's proclamation, is this appropriate to be added in, or should it be done during regular session?
So, Mr. Asher, before you answer, I see that we have UNLV at the table down south. They can answer the questions about the project itself, and then we'll come back up to you to answer the legal questions. Thank you.
Thank you, Chair Monroe Moreno and members of the committee. Chris Heavey, Interim President of UNLV, for the record. This project is on the same timeline as the UNR project. We have been actually working on this project a little bit longer. It's been in design for 9 years. We were appropriated the planning money. We already have the initial conceptual drawings. They've already hired the architects. The State Public Works is in the process of moving forward with the contractor for the CMAR for this project. And so it's basically as equally shovel ready as the UNR project. And as people in the committee may know, this is building to move our Lee Business School in, where there was the tragic shooting in 2023. And so there's a great sense of urgency to be able to move the occupants of that building into a new space. It's also the largest college at UNLV, and UNLV has hit its record enrollment, and we're bursting at the seams. And so there's definitely an urgent need for the space for this building. Thank you.
Assemblyman O'Neill, did that answer the question that you had for them?
Yes, and it's in progress.
Okay, so now just
Thank you.
on to
That's
the
on the-
legal.
Thank you, Madam Chair. Asher Killian, Legislative Counsel. So the business that may be considered by the legislature during a special session is defined by Article 5, Section 9 of the Nevada Constitution, which in pertinent part provides that the legislature shall not consider any bills except those related to the business for which the legislature has been specially convened. The important language there is the business for which the legislature has been specially convened. The guiding Supreme Court case on this from the Nevada Supreme Court is Henry Platts, which was from 1940, which interpreted the extent of legislative power under that provision. And in that case, the Supreme Court held that any piece of legislation should be held within the call or message of the governor to the legislature in special session if it can be done so by any reasonable construction of the proclamation, and that the language must be strictly construed in favor of the power of the legislature to enact the legislation before it. In this case, there was an item in the governor's proclamation that specifically called for an appropriation for a building for UNR, but the legislature doesn't look just to items specifically noted for appropriation. If a business building for UNLV would be embraced by the policy specified in any other part of the proclamation, then it would be within the power of the legislature to make such an appropriation. One of the items that was called out in the governor's proclamation was AB 238, which was the film tax bill from the regular session. That is, broadly speaking, an economic development bill, and portions of that bill, as it existed during the 2025 regular session, made appropriations to entities within INCHE for various economic development functions related to the film industry. Since the appropriation being sought for UNLV is specifically for a business college building, that would fit within the general topic of economic development that the governor's proclamation opened the door to with the inclusion of AB 238 as an item that the legislature may consider. The proclamation does not specifically have to call out the power to appropriate. If the policy is open to the legislature, then it's an inherent power of the legislature to make any appropriations that are necessary to carry out the policy that's before the legislature. So it's a long answer to a relatively short question, but that's the basis within the proclamation by which the legislature can consider this appropriation. And the law does not require it to ride in the same bill that raises the policy. So since the legislature has chosen as a matter of legislative procedure to contain most of the appropriations in a single single bill. It's acceptable for that appropriation to be in this bill, even though that's not the topic that authorized the legislature to act in this area.
So yes. That's.
The short version is yes, Assemblymember.
I'm trying to figure out how to summarize all of that to some people that have asked me. So I'll just say, Mr. Asher says so.
I believe
Thank
they
you,
could also view the footage on YouTube, Assemblymember.
Thank you. Thank you, Chair, for the time.
Assemblymember Watts?
Thank you, Chair. I really appreciate this. And I don't have a question. I just have a comment. I just want to thank you, Senator Dondero Loop, for your efforts on this. I am really excited as someone who represents the main campus of UNLV that we are going to be moving forward with the construction of this building, which is so important to the campus community, and very excited that we have much needed projects for our higher education institutions across the state that are also going to put people to work. So thank you for your efforts to include this.
Thank you. Are there any other questions for our legal before we release him back to the dungeon of amendments? All right, not seeing any. Thank you so much for being here. We appreciate it. And thank you, Senator Dondero Loop, for your patience. We'll go to section 4, and we will be going back to UNLV and UNR in section 13 and section 13.5 when we get to that. So thank you for coming up to answer those questions. Good evening.
Good evening. Thank you very much for having me. I am Marilyn Dondero Loop, representing Senate District 8, and I'm here to address the appropriation for the Nevada Commission on Innovation and Excellence in Education. The commission was created during the 2023 legislative session and has been working to address their charge, which is to develop a statewide vision and implementation plan to improve the public education system in Nevada. The Commission's work to date has focused on building and implementing a comprehensive roadmap to ensure that learners throughout Nevada have access to personalized, quality, competency-based learning. A lot of work in progress has been made, and the Commission needs the following appropriations identified in order to continue that progress. The Commission is addressing the following 3 major tenets: metrics, world-class teaching and learning, and next-generation pathways. The requested appropriations are as follows: $25,000 each year for the biennium for travel and meeting expenses for the commission. We have many of our members who are from northern Nevada or the east side, where the eastern part of Nevada where Ely is, or Elko, and they come down and they travel to Las Vegas. $1.9 million to enter into a contract with the qualified entity to provide professional development for teachers and administrators regarding the implementation of learning programs and the redesign of schools and school cultures to create higher performing projects. And the commission is developing recommendations to assist the Nevada Department of Education in implementing those recommendations. Improving Nevada's education system is crucial to preparing our students for the future, and the Commission on Innovation and Excellence in Education is committed to work with the education community, business, legislators, and others in the strategic effort to modernize Nevada's educational system. I appreciate your attendance, and Madam Chair, I have Ms. Lisa Ford in Las Vegas from the Nevada Department of Education, and she is here to also answer some questions. And if you don't mind, unless you have some really detailed questions, I'm going to slip out and continue chairing my meeting that is going on so we can get all this done.
Well, thank you for being here, and you are excused to go back and chair your meeting so we can get out of this special, very, very special session as early as possible.
The very special session that we feel like we've been here and we're on day 122. So
Yes.
thank you very
Thank you
much.
so
Thank
much
you
for
for
joining us.
listening, and I appreciate all of your time.
Thank you.
And I'll turn it over to Lisa down in Las Vegas. Thank you.
Thank you, and thank you for joining us. You can go ahead.
Good afternoon, Madam Chair. This is Lisa Ford. For the record, I'm the Interim Deputy Superintendent and Chief Strategy Officer of the Nevada Department of Education, and I'm here to answer any questions you might have on sections 4 and 5.
Members, you just had an overview from Senator Dondero Loop. Does anyone have questions for sections 4 and 5? We'll go first to Assemblymember O'Neill.
Thank you, Chair, and I'll make it real quick. The money appropriated for this fiscal year, will that roll forward? We're halfway through the budgetary year. And so since they're equal, 25, will the money move forward that has not been spent in this year, or are there plans where it's, will be used completely?
The money would be Lisa Ford for the record, the money would be allocated for travel that is remaining in the rest of the fiscal year. There are quite a few meetings that are still scheduled for the commission that would require in-person attendance, as well as subcommittee meetings that might require in-person attendance to address the world-class teachers and leaders, the next generation pathways, and the contract also would be allocated to the vendor that was selected in order to support the work. And any money that would not be used within the fiscal year would, it's my understanding, would not roll over. It needs to be used within the fiscal year.
Thank you. Thank you.
No follow-up?
I can take it offline with Ms. Greenmeyer, actually.
Sounds good.
Thank you.
Assemblymember Koenig?
Yeah, and I don't have a question, I just have more of a comment. I'm actually on the Commission for Innovation and Excellence in Education, and, as of last session, the funding for travel was taken away, so I think we traveled 2 or 3 times a year down to Vegas for the meetings, and this last one we had to do by Zoom, but the way it worked out, it was like an 8-hour day, and when we broke off, they couldn't hear anything I had to say, so we're in group discussions, and so you sit there and watch a group discussion, but you couldn't contribute or say anything, so I think I lasted about 3 hours and I was done, because it was worse than sitting in here. But I think to have,
Boy, that hurt. Thanks.
that commission to continue, there needs to be travel allowances, and they need to get us together face to face, or it's just not effective.
Well, thank you for that painful comment. Members, any other questions or comments on sections 4 and 5? I'm not seeing any. Thank you so much for joining us tonight. And we'll move on to section 6, the Division of Public and Behavioral Health. Good evening.
Good evening, Madam Chair, members of the committee. For the record, Andrea Rivers, and I serve as the Administrator for the Division of Public and Behavioral Health within the Department of Human Services. I'm also joined today by Ricky Robb, Interim Director for the Department of Human Services, and Kevin Schiller, County Manager for Clark County. Before you today is SB 4, Section 6, a general fund appropriation in the amount of $15,615,919 to support the jail-based programs in Washoe and Clark County. This breaks down is $7,515,919 to Washoe County and $8,100,000 to Clark County. With this appropriation, Washoe County will be moving forward with an expansion of their current jail-based program treatment program to include competency restoration. At this time, the appropriation to Clark County will maintain the current jail-based SMART treatment program. We are requesting a conceptual amendment of Appropriations, Section 6.5, to the IFC contingency funds, allowing DPBH to request up to the amount of $5,406,013 to partner with Clark County for the planning of and potential expansion of their current program and jail-based services throughout the biennium. Current jail-based SMART treatment programs have been in both Clark and Washoe County jails since mid-2024. Jail-based competency restoration, enhancing the current program, was signed into law through AB 467 of the 2025 legislative session and will begin on January 1st of 2026. Jail-based competency restoration allows the opportunity to offer more immediate psychiatric care to individuals who would otherwise be awaiting an inpatient forensic bed. Research has shown that earlier intervention of psychiatric treatment leads to better outcomes for individuals with serious mental illness. Offering jail-based restoration prioritizes an individual's psychiatric needs by making the program available to them in the detention center. While certain individuals, due to severity of their mental illness, will need inpatient care, there exists a subset of individuals who would benefit from jail-based restoration, since this would allow for quicker intervention. This may also help mitigate future state-assessed fines and sanctions by the courts. We understand our county partners need support and collaboration, and both counties are coming from different places with different needs. DPBH stands committed to these partnerships and working with all county partners throughout the biennium and into the future to accomplish our goals. This appropriation requested today will provide a step forward in this partnership. We're happy to stand for any questions you may have.
Thank you so much. Mr. Schiller, did you want to say a few words?
Yes. Good evening, Chair Monroe Moreno, members of the committee. Just want to say a couple things. First, thank you for your consideration related to this $8.1 million. Want to talk a little bit about the collaboration we currently have and that we've been working through. So in working with the state, we have spent a significant amount of time implementing the SMART program going back to about summer of 2024. We have seen about 552 clients in that time period. One of the key pieces that I kind of want to enumerate from kind of the Clark County perspective is the fact that on the county side, we have 100% responsibility for those detention costs. And one of the key pieces when you start looking at client-centered services, and clearly for us, what's best for the client is obviously of critical nature. We want to ensure that we can provide the most critical service, and at the same time, and I'm preaching to the choir because I know you've heard this topic, the issue of timeliness, efficiency, and those centered services always become a struggle. That results in cost to you, that results in cost to us, specific to detention. And then obviously in our system of care, the SMART program is a key success. So if I had my detention staff sitting here, if I had my Metro Detention Chief sitting here, they would be telling you how important this program is in our system of care. For those of you that don't know me, my background is human services. This is my world. This continuum has to be built. And I believe in the competency side of things and restoration, when you get to that far end of that continuum, on the Clark County side, the complexities include the milieu of our patients and those that are sitting in detention. So we're doing a capital project over here. We're moving clients from A to B to C. These dollars are actually critical when you look at this additional 5.1. Very assisted to us because it gives us the flexibility to enter into the pool with services and programming and kind of edge our way into this to see that we can get those evidence-based results that I just talked about. We have a lot of stakeholders. Some of you have been in this pool. There's public defenders, we have district attorneys, we have judges. I myself have been participating in those meetings and can say to you, we are invested in meeting these guidelines and meeting these evidence-based practices. So as much as it's an ask and saying, hey, can you please give us a contingency fund, what I also want to put on the record is we're very invested in this for both our benefits. We believe the system has to change proactively. My belief is we can make those proactive changes, and what I really hope to come back to this body with is when we enter the next session is be able to give you some baseline numbers on what those results have looked like and what those outcomes have looked like. And that's why I wanted to speak to the SMART program, because without your support, we would not have that program. So I think there's really two critical pieces here. So in full support of this, obviously, and I just want to thank you for your consideration, and I'm happy to answer any questions.
Thank you so much. Ms. Rabb, did you have anything to say?
Good evening. Ricky Robb. I serve as the interim director for Department of Human Services. And really, I'm their backup singer today. Just want to make sure that you all understand that the state is truly invested. We've been working with the counties, and we're invested in that. So we'll be working towards the planning as well as implementation with both counties, but obviously with Clark County as we're navigating what's next. And so really, we're just here to make sure you all know that we're in this together, and we'll continue to do the hard work and make sure that all of the individuals that we serve are getting what they need.
Thank you so much. And I believe we do have just a few questions. We'll start with Assemblymember Anderson.
Thank you, Chair, and thank you for the information. I know I've met with many of you. My question is actually, it was touched upon by your answer a little bit, and that is the fact that, is this money primarily going towards staffing? Is it going to changing programs? Or is it going, I don't believe it's going to infrastructure of buildings, but it could be, because I know that in Washoe County that is a huge issue of the actual space, but just trying to figure out what the majority of that is, and we can also get that information offline if you'd like.
For the record, Kevin Schiller, Clark County Manager, through the chair to Assembly Member Anderson. It's all of the above, but I think if I was going to hone in on some specifics for you, really as we look to expand those services and we kind of edge into that, I think there's probably three primary focuses. You might have some tenant improvements tied into detention, so we can create that compliance for the milieu. The second piece that I would probably highlight is third-party contractor. As you know, staffing this subject area is very difficult, so we would be doing that in concert with that. And then also, because of the population shifts, you'll also have a metro staffing requirement, because sometimes moving certain detainees requires different levels of supervision. But I think what we would hope to do, we do have and I'll just put this on the record, we have about a 60-bed facility that we're going to use to explore this. So within that realm, that's kind of what we're basing those numbers on, and what we can kind of edge up to. And my hope is that we'll be able to report to you some successes in that in terms of numbers and also those results. So happy to share it going forward also.
No follow-up?
I recognize as Clark, and I really do appreciate that, and it's difficult to figure out what's going to happen in Washoe. So hopefully we can get a little bit more clarity about that also if, at some point, just because I think the spacing is a large issue right now with some of our court cases, from what I understand.
For the record, Andrea Rivers, Division of Public and Behavioral Health. I would like to ask Mr. Drew Cross, our statewide forensic director, to come up and can answer a few of those questions too. But as Mr. Schiller stated, a big portion of the competency restoration cost is going to be that third-party vendor who implements these services in other states, including California. That is a cost as well as the staffing. And Mr. Drew Cross can add anything if there's anything additional. I don't think we have anything additional to that, but as Mr. Schiller stated, the third-party vendor is a big cost.
I totally understand. I appreciate all of you being here to talk about this. I will continue to follow up also with the Washoe County individuals to try to get a little bit more clarity, and once I do that, I'll bring that forward. Thank you. Thank you, Chair.
You're so welcome. Members, any other questions on Section 6 or the amendment as proposed for Section 6.5? All right, not seeing any. Thank you so much for being here tonight.
Thank you.
We will move on to Section 7. It's the University of Nevada, Reno for Nevada State Public Health Laboratory. Good evening.
Good evening, excuse me, Madam Chair, Madam Vice Chair, members of the committee. For the record, Brian Sandoval, President of the University of Nevada in Reno. Thank you very much for your willingness to consider this item within the bill, where we're seeking $7.63 million for the funding for the State Public Health Lab that is currently under construction, and we're hopeful that it will be finished in August of this year. And as you recall, funding of $75 million was approved by the Interim Finance Committee for the construction of this lab in 2022. However, due to construction inflation and increases in labor costs and other matters, we used all the contingency funds within that budget. And in order to assist with that, we carried out value engineering reductions. We delayed essential equipment, and that reduced our contingency to approximately 1%. So we're here today seeking that $7.63 million for us to be able to finish construction, and more importantly, to equip the building. It's an amazing building and will be one of the finest, if not the finest, state public health lab in the United States of America. But it's not a lot of good to have the building and not have the equipment to do the testing. So with that, Madam Chair, I'm going to be brief, but again, we respectfully request your favorable consideration of this item. Thank you.
Thank you so much. And you did say the IFC for 2022, that's what you said?
Yes.
Okay. Members, any other questions? All right. Not seeing any other questions. Thank you so much.
Thank you, Madam Chair.
That moves us on to Section 8 of our bill, the Department of Indigent Defense Services. Good evening.
Good evening. My name is Peter Handy. I'm the Executive Director of the Department of Indigent Defense Services. As you know, we're asking for a $3 million allocation. This is to fund stipends for the Nevada State Public Defenders and for compliance with the Davis obligations going on. As you may know or not know, we did receive an extension for compliance in the Davis consent judgment until August of 2026. However, as it's already November, that date is quickly approaching, and this funding would be great assistance to be able to get to meet our goals in time. I'm happy to entertain any questions.
I think we hear about Davis and indigent defense at every IFC meeting for the last few years.
I feel a bit like Bernie Sanders. I'm asking you again.
So I'm not sure if anyone has any questions, because we've heard this a few times. But members, I will ask, does anyone have any questions on Section 8 of this bill? Assemblymember Backus.
Thank you so much, Madam Chair. And I don't know if these funds would be used for this, but I know you were starting to create like the Humboldt, moving folks from Carson City up to Humboldt. Were you guys able to fill like those positions? Or are you still having to use contract attorneys? And with respect to these funds, are these going actually into the cost for contract attorneys or like incentives? I know we've looked at so many different costs at each IFC, but just kind of more clarity on where the $3 million will be going.
Sure, I think a few things. So first, we did fill some of those positions in Humboldt County.
If you could just restate your name for the record. I'm
Peter
so sorry.
Handy for the record.
Thank you.
Thank you, Madam Chair. We did have 2 people take positions that are attorneys, at least in Humboldt County. As of last Friday, they left those positions for better paying jobs or because the travel was onerous. This would be hopefully used to provide stipends to kind of front the cost for that travel for these attorneys. As you know, they're traveling very long distances, very hard to recruit in these rural areas, so they're having to commute oftentimes several hours, several times a week, stay in hotels overnight, be away from their friends, their family, their normal, place where they have to live. So this would be to try and offset those expenses and those kind of cost of living expenses. We're also going to be using it for programmatic things. The monitors requested that we receive technical assistance, so that'd be used to fund technical assistance programming or consulting, so that we can ensure that our programs are improved. It likely will result in funding contractors in many places. As I mentioned, since compliance is due in August, we anticipate that we'll have either full compliance with workload standards for each of the counties that Davis requires, or be in corrective action to get into a place of compliance, and that will probably require contractors. So that is somewhere where those costs are going to be expended.
Thank you so much for that answer. Members, any other questions? All right, I am not seeing any. Thank you so much.
Thank you.
That will take us to Section 9 of the bill, the Division of Social Services and Department of Human Services. Good evening.
Good evening, Madam Chair and committee members. For the record, I'm Kelly Cantrell, Deputy Administrator with the Division of Social Services. As you all are aware, I'm sure, the H.R. 1 legislation has changed the way we manage the SNAP program. Beginning October 1st of 26, the federal share of the SNAP administration cost has reduced from 50% to 25%, which shifts a substantial cost onto states, and of course Nevada's no exception to that. The $19 million that's being asked for in this item is to cover that portion of the administrative cost from October 1st of 26 through June 30th of 27. The other thing that the H.R. 1 legislation does that impacts states is in October 1st of 27, there's a new cost sharing plan, if you will, that shifts burden of a percentage of the benefits that go out to the customers to states based directly on the payment error rate. So if a payment error rate is 6% or higher, that's a 5% shift that goes to states. And Nevada has historically been in that 6% to 7.99% error rate. We have come in a couple times under that 6%, but historically we live in that 6%. And so we have been working diligently to implement plans to reduce that error rate and to come in under that 6%. And so this second amount that we're asking for, the 2.5 over the 2 years, is to gather technology initiatives that can help reduce the error rate by utilizing data analytics along with continuous income evaluation to let us know when income goes over the SNAP threshold. And we anticipate, we hope, I should say, that these two initiatives could potentially lower the SNAP payment error rate for Nevada by up to 2%, which would bring us under that 6% error rate, which is our goal. And I'm here for any questions that you might have.
I think we have a few questions. We'll start with Assemblymember Mosca.
Thank you, Chair, and since you all are here, I just wanted to thank you and your team for all that you've done. It's crazy, it's only been 15 days since November 1st, and we know how hard that you've been working. I know all of us, because it was unanimous, are excited about SB 3 and what can happen if this man-made crisis happens again. And so really, I think that these services are very important, and I'm glad that they're here. I'm really just going to ask for the record, how is SNAP going currently? And if you could share for our public to understand what has happened.
So I'm happy to report, Kelly Cantrell for the record, I am happy to report that as of 11 p.m. on November 13th, 100% of SNAP benefits did roll out to all eligible SNAP customers. We issued 50% of the maximum allotment on 11/4, or maybe 3rd, don't quote me on that. But we got 50% out within 9 hours of being told to get benefits on the card. We had folks that worked till 2:30 in the morning to ensure that that happened. A couple days later, we got the 65%, and then as of the 13th, 100%. So everyone has been restored fully.
Thank you for that. And I was going to do the same as my colleague. I know that your staff was working overtime. Some people just took maybe an hour and a half, 2-hour nap to make sure that families in our state didn't go hungry. So please know that the work that they are doing, the work that you all are doing, does not go unrecognized. We truly appreciate you standing in the gap for Nevada's families. So my only question is, with the new error rate rules, is this enough money?
Kelly Cantrell for the record, I hope so. And I don't know that money can truly fix an error rate. You have unintentional processing errors that the agency makes. And historically, like we closed out last year, the state error rate was under 2%. It was only 1.67%. And we were at 5.94%, so over 4% was related to customer errors. And what that means is they didn't understand how to report, or they failed to report something that maybe they didn't know that they should report. And so some of these initiatives will help catch some of those errors as soon as they're found and allow us to address them quickly so that they don't continue being errors on our books. So we hope so.
Good afternoon, Robert Thompson for the record. I'm the administrator of the Division of Division of Social Services. It's still hard not to say welfare after 29 years. One key point of information that I do want to interject during Ms. Cantrell's presentation is the error rate difference. If we do go over that 6% mark, the 5% that Ms. Cantrell spoke about equates to approximately $50 million a year of general fund. So while we're asking for $2.5 million to invest in our technologies in an attempt to bring that error rate down by 2%, the $2.5 million risk that we are not 100% sure that we will get under that 6%. That is our attempt to get down under 6%. We're risking $2.5 million in an attempt to save $50 million per fiscal year in the future.
Thank you for adding that. That's very important. I appreciate it. And thank you, Mr. Thompson. I know you've had some sleepless nights in the last few weeks as well. I believe we have another question from Assemblymember Backus.
Thank you so much, Madam Chair. And I just had some follow-up on that error rate because it does look, it seems awesome. You guys are already starting to implement the software early. But if the, like, I guess what period of time are they looking at to gauge what our error rate is? And then on the backside, and this may be something for our fiscal or maybe legal, I'm not even sure who could answer it. If once our error rate is determined, when would we have to contribute the 5%, the $50 million? And it sounds like it may have to go something back to the federal government because we obviously, I just don't know how it all works out. If you could explain that, that would be helpful.
Kelly Cantrell for the record. So the first federal fiscal year, it can be either based on your error rate for the fiscal year 25 or 26. So if we don't meet at 26 or 25, we still have another chance to come under that 6% in fiscal year 26. So 25, 26. And we don't know yet exactly how that's going to work. We anticipate, or we think that that may be billed retroactively because the error rates come in much later. The new year will have already begun and we won't know our error rate yet. So we are anticipating that might be a retroactive, but the guidance hasn't come out on that just yet.
Thank you so much. Hopefully that, if that money has to trigger, it would be like hopefully at the time period of our 2027 session. So I appreciate that and thank you, Madam Chair.
Thank you. Members, any other questions? Right, not seeing any. Thank you so much for being here. That we'll move on to section 10, the Nevada Health Authority. Good evening.
Thank you. Good evening, Madam Chair and members of the committee. I am Jennifer Krupp, the Division Administrator for the Consumer Health Services Division within the Nevada Health Authority. I am joined today by Director Stacy Weeks of the Nevada Health Authority. We're here to talk about Section 10 and Section 11 of SB4, the Appropriations Act, that would allow the Nevada Health Authority to assist with enrolling consumers in health plans under the public option for Section 10 and in Section 11. These funds would help support consumer shopping and enrollment for both Nevada Medicaid and through the public option program. Thank you, and I'm happy to answer any questions that the committee may have.
Thank you so much. Members, any questions on Section 10 of the bill? Well, they don't have any, but I'm going to ask. This Nevada Health Authority is something that was developed during the last legislative session. How has the transition been?
Madam Chair, Stacy Weeks for the record, Nevada Health Authority. It's going really well. We did have the cyber attack, which I think threw all of us off our donkeys for a bit, but we pretty much have migrated over to the new department, and we're one department now. So we are now trying to get everything implemented from last session and get ready for all of you in the next session. So it's going well. Thank you for asking.
Sounds good. Thank you so much. And seeing no questions, I'll say thank you for being here. That takes us to Section 11, and I apologize for standing up. For those of you that don't know, I recently had knee replacement surgery, and sitting for too long is not good. So we'll move on to Section 11.
Thank you, Madam Chair. Jennifer Krupp for the record. I got excited and talked about Section 11 already, but Section 11 would allocate $2 million to the Nevada Health Authority to support navigator assistance programs to help support consumer shopping and education and enrollment into Nevada Medicaid and public option programs.
Members, any questions on Section 11? Not seeing any. Thank you so much. We may get out of here before midnight. This will be great. Section 12, Nevada Boards and Commissions and Council Standards. Good evening, and thank you for joining us.
Good evening, thank you. My name is Nikki Haig. I'm the Deputy Director of the Office. Is it on? Sorry. My name is Nikki Haig. I'm the Deputy Director of the Office of Boards, Commissions, and Council Standards with the Department of Business and Industry. And with me is Emily Servey, who is our ASO4, overseeing our fiscal department. And we are asking for the $330,550 for the Office of the Nevada Boards, Commissions, and Council Standards, which was established under SB 431, now codified under NRS 232, 8413, and 8415. We oversee the 34 occupational licensing boards statewide. Although both the Deputy Director and the Management Analyst 2 positions were funded for fiscal year 26, no funding exists for fiscal year 27, leaving the office unable to fulfill the statutory oversight, regulatory, and compliance responsibilities mandated by the legislature. So we are asking for the funding for the fiscal year 2027. If you have any questions, we'll be happy to answer.
Thank you so much. Not sure how we didn't fund 2027, but that's interesting. Members, any questions? Not seeing any. Okay, then I guess we need to fix that mistake. Thank you so much. It takes us to Section 13 of the State Public Works Division and of the Department of Administration. That takes us back to UNR and UNLV again.
May I proceed, Madam Chair?
You may proceed, yes.
Thank you. Thank you, Madam Chair, Madam Vice Chair, members of the committee. For the record, Brian Sandoval, President of the University of Nevada in Reno, and thank you very much for your willingness to consider this bill. We're requesting $68.5 million in state funding to construct a new 84,000 square foot life sciences building. The Nevada urgently needs more graduates in the life and health sciences. This building will serve more than 4,000 students every year preparing for careers as doctors, nurses, veterinarians, lab technicians, dentists, environmental scientists, and professionals in biotechnology and public health. The existing building in which we teach these students was built in 1963. I think some of you have had the opportunity to tour this building and is functionally obsolete. Our teaching labs provide only 30 square feet per student, ranking us last among our peer institutions. Research space is a third below the national medians. The current building simply cannot support Nevada's growth in STEM, medical, and biosciences fields. Also, that is significant for this building is that we have a contingent $30 million gift for this building, and we stand to lose that gift, the largest philanthropic investment in a science facility in our history. The donor commitment is contingent upon timely state approval and funding. The new life sciences building aligns directly with Nevada's workforce and our economic priorities. It will expand our teaching and research capacity, support our R1 growth, attract top faculty and students, and deliver the highly trained professionals Nevada needs in medicine, biotechnology, agriculture, environmental science, and veterinary science. So with your support, the project can break ground in 2027 and open in 2029, delivering immediate, lasting, and economic and workforce benefits, Madam Chair. And similarly to the testimony you heard from the University of Nevada at Las Vegas, we already we finished pre-design, we have a contractor, we have a piece of property, an empty, beautiful piece of property on the south end of campus that is ready for construction, and we have had extensive conversations with labor and have an understanding of doing a project labor agreement. So with that, Madam Chair, happy to answer any questions.
Thank you so much. I know we do have one question. Assembly Member Anderson.
Thank you, Chair, and go Pack, so thank you very much. Just wanted to double check on the PLAs. I know that you have had them in the past. Don't know if they're always in legislation or if it's a letter of intent or how that works, but just wanted to double check that. And I believe you mentioned that, so don't know if you need to answer or not, but always
Madam
good to
Chair,
stand up
for the record, Brian Sandoval, to you and through you to Assembly.
You can go directly to the member.
Okay, thank you, Assemblywoman Anderson. So similar, we have a project. I spoke before about our state health lab, and there is a PLA on that project. And similarly, we intend to have an identical project labor agreement on this building. You're welcome.
Assembly Member Backus.
Thank you so much, Madam Chair. And I just kind of have two questions. One is, I guess the I guess it would be $98 million budget adequate to get you all the way through finished construction in 2029. And then I know you said you finished the pre-design phase. Have you started construction documents, and will this money then be able to cover both?
Yeah, Madam Chair, to the Vice Chair. So that's not the total cost of the project. Essentially, it is $137 million. So we would have the state funding, which is traditionally and historically half the cost of construction. And as I mentioned, we have that contingent $30 million, and then I'm confident that we will probably have some more philanthropy, but also use bonding to complete the construction of that building. And if you could remind me your second question.
Thank you. My follow-up question in that was, because you were talking, it just got done with pre-design, so I was just curious. Obviously, it sounds like you still have to do development design and construction documents before construction can start, and I don't know if that's going to take like 3-5 months.
Yeah, Madam Chair, Brian Sandoval, for the record, yes. Yes, we're doing that. No, we don't have those design documents right now. Yeah, fall of next year.
And thank you for that total cost and how the funding would be done. Appreciate that.
Members, any other questions for UNR before we go down south for UNLV? All right, not seeing any. Thank you so much.
Thank you.
Thank you, Madam Chair and Vice Chair, members of the committee. Chris Evie, Interim President of UNLV, for the record. Pleased to be before you today asking for consideration of funding of our Lee Business School new building. This would be a 131,000 square foot building that would house the largest college of UNLV with more than 4,700 students. It has 6 different programs, majors that are housed in that college, and 4 centers. As I mentioned earlier, we're bursting at the seams and also extremely eager to be able to move the faculty out of the building, and where they suffered a terrible tragedy in December of 2023, losing 3 of their colleagues and having 1 other gravely injured. The total cost of our building will be a little bit higher. We're estimating 175 to 185 million, but we're confident that we can have the funding capacity through philanthropy and through bonding capacity of the university to secure all the funds. And we recognize that the bill is written such that the State Public Works won't start construction until we've secured all those funds. So we will move with full alacrity on that. And happy to answer any questions. And I guess I'll add that we will absolutely follow UNR's lead in the project labor agreement. I've already been in contact with the labor unions down here and gotten a letter of intent from them that we've forwarded on to our NSHE legal counsel to begin work on that process next week. Happy to answer any questions you may have.
Thank you. We do have a few questions from members, but before we go to the questions from members, there's a question we have on 13.5, section 3 of the bill, and I'm going to turn it over to our committee staff just to get a little bit more clarification.
Thank you, Madam Chair. For the record, Sarah Kaufman, Legislative Council Bureau. Yes, this is also for section 13 as well as for section 13.5. In the bill as reprinted, there were two additional subsections that were added, subsections 2 and subsections 3. The first subsection indicates that State Public Works Division shall not execute a contract for construction of the projects described in subsection 1 until the division has determined that the funding for the projects that is in addition to the money appropriated in subsection 1 has been awarded or received and is available for expenditures. Traditionally, when we do a CIP project, we identify in the specific bill both the appropriations as well as the authorized funding, so that in subsection 3 then it applies that that additional funding that is not the funding that is appropriated can be utilized first. So Madam Chair, both of the institutions have identified the total amounts. So fiscal staff would recommend a technical amendment to the bill that would allow you to include the authorized amount for the non-appropriated amounts for those two specific sections.
Thank you so much. I will go to Assembly Member Carter for a question.
Thank you, Chair. And yeah, my question is similar to what my colleague from the north just asked about UNR. And I just want to make sure that we've got a commitment for a PLA to be put in place for this building.
Thank you, Chris Heavey, for the record. Assemblyman Carter for that question. Yes, you have a commitment from me. Thank you.
Assembly Member Torres.
Thank you, Chair, and thank you for the presentation. I know I had the opportunity this week to meet with UNR, and they had talked to me a little bit about their investment, I believe through the foundation of $30 million. I wanted to know what investment UNLV will be making towards that building as well.
Thank you for the question. Chris Heavey for the record. We are about to begin our capital campaign, and so we don't have a parallel large gift, but we've already begun discussions with donors who might be in a position to make naming level gifts at an amount similar to what UNR has described. And we will embark on a full capital campaign for the building immediately with our new head of our foundation, who was just announced this past week, who's eager to engage on this project. And then we will use our bonding capacity to fill in anything else that's needed. And we've already identified that if necessary, we could bond $100 million plus for this building.
I'd like to thank both institutions for your presentation tonight, and as you've heard that we need to make a technical amendment to the bill just to correct it before we work session it, but we will get that done so we can be expeditious with getting the work session documents and amendments ready. But thank you both for being here tonight, both in Carson City and in Las Vegas. Moving on to, I think, our last section where we need explanation would be section 14. And that is the Director of State Chief Information Officer of the Governor's Technology Office. Good evening.
Good evening, Madam Chair and Madam Vice Chair. For the record, Timothy Galuzzi, State Chief Information Officer and Director of the Governor's Technology Office. I'm here to present Section 14 of SB 4. The item will adjust the salary of the director position to bring it to parity with other directors across the executive branch. For some background, the agency that I represent was elevated out of the Department of Administration during the 2023 legislative session with SB 431. The timing of that passage was such that budgets and rates of, and the pay bill were already set, so this position continued the subsequent biennium, serving at the cabinet level as a cabinet level official with statewide duties and responsibilities at the administrator and deputy director pay level. Leading up to the 2025 legislative session, there was a classification and compensation study conducted by the Division of Human Resources Management that would have included adjustments to this position. Unfortunately, due to the holistic nature of that classification and compensation study, it had to be pulled because of budgetary reasons, leaving this position at the same parity level that it had prior to that 2023 session, before the elevation out of the Department of Administration. Our ask is to bring this position to parity with other directors throughout the executive branch. I'll make myself available for any questions.
Members, any questions? I do have one question. You said it would bring it into parity. What is the difference? And if you stated it, I am so sorry.
It's approximately 15,000 is the difference.
And that position is currently filled, correct?
For the record, Timothy Galuzzi, yes, it is.
Thank you. Members, any other questions? All right, seeing none, I thank you so much. Members, the last section of the bill is Section 15. It's the Commission on Innovation and Excellence in Education, and it's the makeup of that commission. Are there any questions that members have on Section 15? I am not seeing any. All right. Well, I thank you all for being here and presenting. I know it was a little tedious going through it section by section, but I think it was necessary. And seeing that we have no other questions on this bill, I will open it up for testimony in support. If there's anyone that would like to testify in support of Senate Bill 4, I invite you to the table.
Good evening, Madam Chair and Committee. For the record, my name is Wendy Colborn. I'm Chief of Staff for the Building and Construction Trades Council of Northern Nevada. We are here in support of Section 13, the request for the UNR Life Sciences building. We have sent an LOI to UNR, and we anticipate that that will be signed, and we look forward to working with them on that building. Thank you.
Thank you. Good evening.
Good evening, Madam Chair, members of the committee. For the record, my name is Cadence Matijevich, C-A-D-E-N-C-E-M-A-T-I-J-E-V-I-C-H, representing Washoe County. Here in support of Senate Bill 4, particularly Section 6. As you heard from Ms. Rivers, the $7.5 million for Washoe County is to continue our current jail-based behavioral health program and expand it to include competency restoration. This has been, as you heard, a very successful program. We are excited about the expansion and what that can bring to bear for the population that it serves, and we ask for your support. Thank you.
Thank you. And thank you for being here. Seeing no one else at the table here in Carson City, we'll go down to Las Vegas. Good evening.
Good evening, Madam Chair, members of the committee. For the record, Alejandro Rodriguez, Nevada System of Higher Education. NCHE in strong support of SB4. We'd like to thank the governor and legislative leadership for pushing forward this strong investment in higher education. And we're particularly urging your support for the sections for the projects for the University of Nevada, Reno, University of Nevada, Las Vegas, as well as the expansion of the Commission on Innovation, Excellence in Education. So we urge your support. Thank you so much.
Thank you. And seeing no one else at the table in Las Vegas or in Carson City, we'll move to opposition. Is there anyone that would like to testify in opposition of Senate Bill 4? And not seeing anyone approach the tables in Carson City or in Las Vegas, we will close opposition and move to neutral. If there's anyone that would like to testify in the neutral position on Senate Bill 4. And not seeing anyone approach either table, we will close the hearing on Senate Bill 4. And thank you all for joining us. That brings us to the last item on our agenda for today, and that is public comment. If there's anyone that has public comment. No. If there's anyone that has public comment, if you'd like to come to the table in Las Vegas or in Carson City, we welcome you. And not seeing anyone approach either table. Members, there are some amendments that we need to work up for the work session document, and we'll work session this bill tomorrow when we have those documents in hand. So with that, this meeting is adjourned.